Hello, Mr. Krishnan. So let's start with my first question. What made you start Healthy Mother?
In 2004, we moved back to India from the US. We spent about 16 years in the US. When we moved to Hyderabad in 2004, Vijaya wanted to get involved in maternity and in childbirth education and related areas. And she was appalled to see the kind of birth practices which were going on in the hospitals and in maternity clinics and in doctors' offices, where women were really treated as patients. A healthy pregnant woman who was going through one of the most exciting periods of her lives was really subject to tests, procedures, interventions, which ultimately made her into a sick individual rather than a healthy, happy person. And a lot of it had to do with the kind of practices which were going on in the medical system. By that I mean unnecessary tests, a lot of unnecessary interventions, a lack of good factual information, and really more than anything else, a lack of empathy on the part of the medical system towards healthy, expecting moms. And so with that, she brought her experience that she gained in the US in helping women gain the knowledge, women and their husbands gain the knowledge and information that would make them confident that they can trust their own bodies to give birth in the way they want. And Lama's education was a big factor in that. And so we started Lama's classes, I think earlier than anybody else in India. And slowly but surely, the kind of knowledge and information expecting moms and dads were able to sift through the myths and facts surrounding pregnancy and maternity care, and were able to understand really what is good for them. And so more and more people started joining our Lama's classes. And so, but the feedback they gave us was that yes, we gained a lot of good information and we became confident in our own ability to manage our pregnancy and birth. But ultimately we went back into the same system, and that system which discouraged confidence in oneself, which in a sense perpetuated the dependence on the medical system, in the sense that pregnancy was a risk and the risk had to be managed, and only the medical community, which is the hospitals and the doctors, they were the only people who were able to sort of manage the risk for women. Whereas for thousands of years, nature had perfected the woman's body to give birth, and our grandmothers and their grandmothers didn't have the medical system surrounding them, telling them what to do. Birth happened spontaneously, birth happened naturally, and they were all active and they all gave birth naturally to like 8-9 babies. And so that was very disappointing, for a lot of our moms who attended Alama's classes, but who had to, for want of any other choice, had to go back into the system. So we thought about it, and we said, okay, what can we do about it? And so we put our money where our mouth is, and we started the Healthy Mother Natural Birth Center, the Sanctum, um, in collaboration with Dr. Jayanti Reddy, a well-known obstetrician in Hyderabad, and Dr. Jayanti Reddy was the only person who at that time who who sort of saw, what our passion was and our motivation was, and so we ultimately started in a very small way. We started the Healthy Mother Birth Center, Natural Birth Center, the Sanctum, and the core philosophy of the Sanctum is a midwifery-led, midwife-led practice, which follows the scientific midwifery model of care, and which is natural birth focused, and which empowers mothers to basically trust themselves that they are the primary caregivers for their unborn baby, and the care providers, that is the doctors, midwives, and other staff, are only their support staff, there to support them in this process.
As a usual trend, I have seen if someone is going off the system, as you said, the system was not to encourage natural deliveries as such. Now you're going off the system, so there would have been lots of challenges or problems you would have faced, or maybe the idea would have faced. Could you just want to elaborate a couple of them?
Yeah.
Or maybe still facing, you still must be facing
Yes.
lots of problems.
Problems problems were huge. First of all, there was nobody else who had done something like this, or who had started something like this. So we didn't have any role model, we didn't have any standards, in India. Come to think of it, India was the sort of the birthplace of the Daima system, and like the midwives of generations back, taking care of pregnant mothers and families, and though their knowledge was gained through word of mouth from generations from their grandmothers and older dais, etc., and which was not very scientific based. Whereas our model of care, the scientific midwifery model of care, was really based on sound science, lots of evidence-based research, evidence-based practice, as was being practiced in a lot of the Scandinavian countries, in many countries in Europe, and of course the UK. The entire NHS, National Health System in the UK, is built on the bedrock of the midwifery system. And so what we did was we made a change. We customized, and we said, yes, the medical system, the medical model of care is a lifesaver in terms of emergency. There is no questions. And but an overwhelming majority of pregnant women are healthy. Their pregnancy is completely healthy. It's only in rare cases where true emergency happens. So we created this wonderful collaborative model between the medical system and our scientific midwifery model, which really cares for the mother during her pregnancy all along. And whereas in times of a true medical emergency, immediately takes the help of our backup obstetricians and other medical staff. When we started, we had to account for two main challenges. One was from the medical system. So they even our backup doctors and anesthetists and pediatricians, for want of anything else, they were new to this model, and so they were very wary of it, and so it took a lot of time, and it took a lot of successive wonderful natural births for them to become sensitized to, yes, there is an alternate model, where it is the mother who actually plays the leading role, but their role is also equally important. When in terms of an emergency, I mean, there are no questions asked. And but the greatest challenge we faced was from our families in the sense, expecting moms, expecting dads, their families, their mothers, mother-in-laws, and because for decades India has seen a dramatic rise in C-sections, and today it is no longer normal to expect a normal delivery. I mean, that's a quote that one of the expectant moms told us, and it was really amazing for people to hear. Yes, we can help them have a normal delivery, and there is nothing wrong with their bodies, even if they have minor issues like blood pressure or gestational diabetes or any PCOD. It doesn't necessarily mean that they have to be condemned to have a C-section. And even if you have a previous cesarean, today once a cesarean, always a cesarean. The concept of VBAC is almost non-existent. We were the first people to really encourage women to try for VBACs, and today we have the highest VBAC success rate in the country. And so it took a lot of education